Claire-Anya, and today we're going to learn a little bit more about a procedure that I found really interesting that I saw in interventional radiology during my rotation there, and it is something called the Y90 procedure. So first I'm going to give you all a brief overview of Y90. So Yttrium-90, which is denoted as Y90, is a minimally invasive treatment for liver cancer. It treats both primary and metastatic liver cancer. So in case you don't know what each of those types of liver cancer pertain to, primary liver cancer is cancer that begins inside the liver itself, and metastatic liver cancer is cancer that has traveled and established itself inside the liver, which means that the cancer grew in a different part of the body and then traveled to the liver and then established itself there. So when I had my interventional radiology rotation, I was able to witness this procedure be done, which was really neat. So before the actual procedure itself happens, something called mapping takes place. So mapping is done to locate the blood vessels supplying the tumors to ensure that when the actual procedure is done, the radiation only goes to the tumor, not to other organs. This is essential because if the radiation on the actual game day went to other organs, it would essentially kill these other organs, which would be highly detrimental for the patient. So the steps of mapping include a couple steps. So in simple terms, the first step is that a catheter, which is a small tube, is placed in the liver's blood vessels, and then doctors locate and block vessels that supply other organs. And then a test tracer is injected and a scan is taken to ensure the treatment goes only to the tumor. So on a different day or on another week, that same exact process is repeated, except one thing changes. So this time, the doctors inject small radioactive beads, which is the Y90 itself, into the blood vessels that feed the tumor. So the beads deliver the radiation directly to the tumors, which kills them. So on my rotation, I was able to witness the actual procedure being done. The patient had mapping done to them about a week prior. So you might be wondering what happens to the radiation that's basically inside the liver. So actually, the radioactive beads stay inside the liver. They don't go anywhere else. So this is because radiation has something known as half-life, which is the time it takes for half of the radiation to fade away. So that means that by day 12 post-procedure, the radiation will not spread and it will not kill other parts of the body, meaning the patient will be fine. So accompanying my explanation, I have a couple images and diagrams here. This is my first one, and the next slide is another one. So what I have here is basically an image of an SPCT/CT scan used during Y90 mapping or post-treatment imaging. So as you can see here, we have a couple colors on these slides, right? So the bright red and yellow areas represent regions where the radioactive tracer used during mapping has accumulated. So this would be most likely the tumor areas in the liver. And then surrounding that reddish yellow area, we have a green and bluish area. And this shows lower amounts of tracer activity. So this scan is essential because it confirms that the radiation is going mostly to the tumor and not to anywhere else in the body. I have a second image here. This is a similar diagram, but basically it showcases the traveling of the Y90 beads to the tumor. So as you can see here, the doctor would insert this catheter through the artery and then travel it through the blood vessels in the liver. And then basically they would shoot the Y90 microspheres into the tumor, which would essentially kill the tumor. So something really important is that this would represent something known as radioembolization, which is when we deliver the radiation inside the body exactly where it is needed and not elsewhere. So something that I really found this procedure is really interesting is because I came here not knowing that radiology could be used for procedures like this, especially treating cancer situations. So that's why I found this specific procedure really interesting. So I wanted to thank you all for listening to my presentation, and